everyone. In this video we are going to start a series, that is Sankalp series. In this series we are going to start the daily MCQs. We are going to do the daily MCQs and wish you all the best for your future. I have made this Sankalp to succeed you, all the nursing students, to crack this exam and to pass this exam. So wish you all the best and I'll help you out to make your future bright. So let's get started with the video. Now our first question is, which is the most lethal arrhythmias? Options are atrial fibrillation, ventricular fibrillation, ventricular tachycardia, sinus arrhythmias. When I see the option A and D, this we can exclude it. Now we have B and C. We are confused in between ventricular fibrillation and ventricular tachycardia. As we know that in ventricular, in VT, in ventricular tachycardia, the rhythm is like this. This is a very synchronized, right? This is rapid, but this is organized, right? This is organized. You will see no P wave. QRS complexes are very wide, right? But ventricular fibrillation, this is the continuous, this type of irregular rhythm is there. This is very uncoordinated and unorganized. Ventriculars contract in a very uncoordinated manner, right? And in this also you will see no P waves, right? And the ventricles are rapidly contracting and the heart rate is very high, ठीक है, बहुत high है इसके अंदर. So VT is converted into VFib. So VFib is the most lethal arrhythmias, right? The answer will be, this is the answer, ventricular fibrillation. Okay. Now our next question is, a nurse is watching the cardiac monitor and notices the rhythm suddenly changes. There are no P waves, the QR complexes are wide and the ventricular rate is regular but over 100. The nurse determined that the patient is experiencing. Here we have two things are very important. The first is the no P waves and the QRS complexes are wide and heart rate is more than 100. Now the options are ventricular tachycardia, ventricular fibrillation, premature ventricular contractions, sinus tachycardia. So in this we can exclude the C and D, but A and B, again we have the options A and B. In A we have ventricular tachycardia and in second we have ventricular fibrillation. Now we have seen that there is no P wave, right? Heart rate is over 100, and third thing is we have QRS wide. So these two things, no P wave and QRS wide, we will see in both the cases, right? But in HR over 100, in ventricular fibrillation, you know that the heart rate is very high, between 300 to 400 beats per minute, right? In ventricular tachycardia, it is more than 100, right? So the answer will be this, ventricular tachycardia. Okay, now the next question is, response to hyperstimulation of vagus nerve is skeletal muscle relaxation, skeletal muscle contraction, tachyarrhythmias and bradyarrhythmias. Now before understanding this answer of this question, we should understand what is vagus nerve. Vagus nerve is 10th cranial nerve, right? It's a 10th cranial nerve and it is a parasympathetic nervous system. It involves the parasympathetic nervous system. And what is the role of parasympathetic nervous system? It helps it to decrease the heart rate, right? So the option from this, we will see that in A we have skeletal muscle relaxation, skeletal muscle contraction, tachyarrhythmias and bradyarrhythmias, ठीक है? जो vagus nerve hyperstimulate हो रही है तो क्या होगा? There is the what will be the action? Decrease heart rate, means the answer will be bradyarrhythmias, right? Answer will be bradyarrhythmias. here in this question we have vagus nerve. Now we'll just understand what is autonomic nervous system and what are their types. Autonomic nervous system is sympathetic nervous system and parasympathetic nervous system, right? Sympathetic nervous system activates its whenever there is any danger or any fear, fight or flight response. Okay, fight or flight response, like whenever a dog is chasing you and what all actions your body is doing at that moment, that is the sympathetic nervous system, right? Like at that moment what will be there, that there is increased heart rate will be there. Like just imagine a dog is chasing you and you are just running away from that time. So what will be there? The decreased heart rate there, and there is, you will see that dog with the pupil dilatation. So there is pupil dilatation will be there, right? There is decreased urination. Urine output will be less at that time because you don't want to you want to run away from there. So decrease urine output. There is decreased saliva production is also less, right? And there is dilation of the bronchial tubules, जो ब्रोंकाई हैं, उस टाइम पे हमें क्या चाहिए कि हम तेज सांस ले सकें, ठीक है? तो हमारे increase bronchial tubules, so और decrease digestion, right? At that time क्या होगा हमारा, everything is this increase heart rate, increase pupil dilatation will be there. There's decreased urine output and decreased saliva production and decreased digestive system, ठीक है? ये सारा क्या होगा हमारा, this will be in sympathetic nervous system. But what happens in parasympathetic nervous system, its role is in opposition of that sympathetic nervous system. Now this is the rest or digest, ठीक है? ये होता है जब resting phase हो, ठीक है? Resting phase में क्या होगा, there is heart rate will be decreased, there is pupillary contraction is there, ठीक है? So decreased pupil contraction. Now there's contraction of the pupils होगा. Now decrease, this will be now increase urine output होगा, right? Increased digestion होगा. There is decreased bronchial tubules dilatation, ठीक है? ये होगा. There's increased saliva production होगा. So everything, ये सब क्या होगा, अब इन अपोजिशन में काम करते हैं एक दूसरे के, ठीक है? So हमारा जो वेगस नर्व है, this is the parasympathetic nervous system. Okay. Our next question. A patient in ventricular fibrillation is about to be defibrillated with biphasic defibrillator. A nurse knows that to convert this rhythm effectively, the machine should be set at which of the following energy level for the best delivery, right? So in this question, we know that patient is having ventricular fibrillation and now is patient is going to be defibrillate, right? So at that time what amount of energy is to be given? Option is 200 joule, 300 joules, 50 joules, 100 joules, right? So before doing this question, we should know what is defibrillation, what is cardioversion, and what is defibrillation, right? Defibrillation. Okay, what happened, these are used whenever the patient is having any cardiac arrhythmias. To treat the cardiac arrhythmias, an electrical shock is given in both the cases. But in cardioversion, this is a planned procedure, right? Amount of energy is given is very less, 50 to 200 joule. Amount of energy is given. It's a plan. It is given in synchronized with the R wave, right? R wave. So this is or mostly it is given in atrial fibrillation, atrial flutter, or we can say the SVT. Okay, so this is the cardioversion. Now the defibrillation. Defibrillation is non-planned. It's in emergency situation is given. So this is unplanned, right? This is unplanned, and the amount of energy is from 200 to 360 joule amount of energy is given. Here it is given randomly, right? Any emergency is there and it's given randomly. Now it's given whenever there is ventricular fibrillation, right? It's pulseless ventricular tachycardia. So in this situation we are giving. So in this question the answer will be, because we are talking about defibrillation, the answer will be, because we are starting from the very minimum joule like 200. So answer will be this. We are starting this defibrillation with the 200. Okay. Okay. Now we have our next question related to this topic. Defibrillation should be given when patient is having supraventricular tachycardia, ventricular tachycardia, pulseless electrical activity, atrial fibrillation. So in defibrillation, answer will be B. Its answer will be ventricular tachycardia, because you know that in SVT or in pulseless electrical activity, atrial fibrillation, we are giving cardioversion, right? So this will be the answer. Okay, now our next question is, which of the following is the most common cause of cor pulmonale? Options are cyanosis, severe COPD, hypotension, and the septal defect. Before doing this question, we are doing cor pulmonale. What is cor pulmonale? Just let's understand with this diagram. Imagine this is the heart. This is right atrium, right ventricle, and the left ventricle. What happens? Because of the right ventricle enlargement, or the causes may be like there is portal hypertension, there is pulmonary hypertension is there, right? Pulmonary hypertension is there, and any lung condition, and koi lung disease hai, like patient is having COPD, okay? Because of that there is right ventricular enlargement is there, and right ventricular enlargement, when because of that the blood pump from the right ventricle less effectively to the lungs, ठीक है? जिसके कारण क्या होता है? The problem is the patient is having cor pulmonale, right? Patient is having cor pulmonale, or you can say the patient having right-sided heart failure. Now the patient at that time the patient will show the symptoms like patient having peripheral edema, there is neck vein distension is there, hepatomegaly is there. So how do we manage? We manage the underlying lung disease. We are giving the medications, like we are giving the patients diuretics because the patient having so much edema. Oxygen, we can give oxygen to the patient. To reduce that hypertension, we are giving ARB and the ACE, angiotensin receptor blocker, angiotensin converting enzyme inhibitors. ठीक है? We are giving this, or we are giving digoxin as well. This increases the heart pumping ability. So this is we are also giving. So this is cor pulmonale. So now we'll see the answer in this question is, we'll see that the option B, where the severe COPD. Severe COPD is in the options. So B will be our answer, right? Because of this, this right-sided heart failure is there. So this is all about the cor pulmonale. Okay, now our next question is the coronary artery which supplies the blood to the left atrium and the left ventricle. ठीक है, हमारे जो left atrium and जो left ventricle, right atrium and the right ventricle. So the left ventricles को जो भी आती है, examples like इसमें we have left coronary artery, we have right coronary artery, right? We in the left coronary artery, the options are this, इसमें है जैसे left circumflex artery, ठीक है? एक तो ऑप्शन यही है हमारे पास. अंदर right coronary artery में we have this sinoatrial, the option B and the option D. These both are the part of RCA. So the answer will be left circumflex artery. Okay, now our next question is, which among the following is not a manifestation of hyperlipidemia? Corneal accus, xanthelasma, xanthoma, erythema marginatum. And now in hyperlipidemia, because of there is increased amount of lipids, fat deposition के कारण क्या क्या हो रहा है. Now in this diagram we'll see this is corneal ulcus. Corneal ulcus is the grayish white ring that is around the cornea because of the lipid excess amount of lipid, right? This is the corneal ulcus. Now the xanthelsma, this is the yellowish deposition हो जाता है फैट का अराउंड द आईलिड्स. ठीक है, आईलिड्स के अराउंड कुछ फैट डिपॉजिट हो जाता है, दैट इज xanthelsma. Now xanthoma is the whenever there is a deposition of cholesterol in any body part, in tendons, right? So this is the xanthoma. So now A, B, C are the excess because of the excess amount of lipids, high amount of lipid के कारण हो रही हैं तीनों चीजें. But B is the erythema marginatum. You will see mostly in the rheumatic fever. This is a non-itchy red rings. You will see this thing in urticaria also, but in urticaria that will be itchy. This pruritus will be there, but in erythema marginatum, they are non-itchy red rings you will see. So this is mostly seen in rheumatic fever. So the answer will be erythema marginatum. Now next question is, what is the infective agent causing atherosclerosis? ठीक है, so first is Clostridium diphtheria, Chlamydia pneumonia, Haemophilus influenza, Mycobacterium pneumonia. ठीक है, so answer will be Chlamydia pneumonia. This will be the answer. It can be Mycobacterium pneumonia also, but the first one is the most infective agent will be Chlamydia pneumonia. Okay, now our next question is, essential hypertension can be managed with a diuretic agent, ACE inhibitors, beta blockers, diet, exercise and weight reduction program. So you know that this essential hypertension is also called primary hypertension, right? So primary hypertension can be managed by diet, exercise, by changing the lifestyle. Okay, you can change it. So the answer will be D, diet, exercise and weight reduction programs. Okay, now our next question is, the enzyme study that is most specific to myocardial infarction is CPK-MB, LDH, SGOT and SGPT. So this is very easy question. As we know that we have myocardial infarction में क्या होता है, drop I, drop T, we have CPK-MB, ठीक है, CPK-MB है, we have myoglobin, right? अब इसमें से questions drop T, drop I, इसमें कोई options नहीं है, myoglobin is also not there, so this is the answer. Now एक इसी टाइप का एक और क्वेश्चन आता है, what is the first elevated enzyme following MI? ठीक है, MI के बाद जो फर्स्ट जो एंजाइम है that is released, that is myoglobin, right? Myoglobin is the first elevated enzyme that is produced, and the most specific, अगर example आता है, the most specific is CPK-MB, and the first जो release होता है that is myoglobin. एक और इसमें से आंसर क्वेश्चन आ सकता है कि which enzyme only found in myocardium? कौन सा एंजाइम जो ओनली मायोकार्डियम में मिलता है? ठीक है, तो ऑप्शन. नाउ वी हैव अनदर क्वेश्चन रिलेटेड टू द सेम myocardial infarction. Which enzyme is found only in myocardium? ठीक है, ऑप्शंस आर drop I, drop T, myoglobin and this lactate dehydrogenase. ठीक है, कौन सा इनसे एंजाइम है जो ओनली मायोकार्डियम में ही मिलेगा, राइट? सो द आंसर विल बी drop I, right? Drop I you will find only in myocardium, right? Only in myocardium you will see drop I. Okay, answer will be this. Now we have another question. The most common site of myocardial infarction. मायोकार्डियल इन्फार्क्शन में जो मोस्ट कॉमन साइट क्या है? एंटीरियर वॉल एमआई, पोस्टीरियर वॉल एमआई, लेटरल वॉल एमआई, इंफीरियर वॉल एमआई, कौन सा वाला? दैट इज most prominent. So the answer will be anterior wall MI, right? So anterior wall MI is the most common site of myocardial infarction, right? So I hope that this video gives a lot of good pointers to you, and there are a lot of good questions that are coming in your nursing competition exam. So stay focused, keep learning, and be motivated. Most of the time you will think that it will not be possible to crack the exam, but wish you all the best for your near future. Make your future bright, but for that you need to hard work, and hard work is the key of success, right?